Hi, I'm Jenny Everland, and I'm coming to you today for a chair yoga practice for stress reduction and better breathing. Let's get started. If your feet don't touch the floor easily, grab a blanket or something to put under your feet so you can rest comfortably. Even if your feet do reach the ground, you might find it more comfortable to have a little extra support. So scoot back in your chair, bring the hips all the way to the back. Check the distance of your feet. We often bring the feet too close together and the muscles in the legs are working to hold the knees together. Bring the feet maybe a little wider, see what feels good, and let your legs relax. Test where your hands are most comfortable. Palms down, palms up, stacked. Let the shoulders relax, and then close your eyes. If you prefer to have your eyes open, you can just gaze down at the ground softly in front of you. And we'll just take a minute here to relax or move toward relaxing. Take your attention through your body, and what are you holding on to? Where are your tension areas? Maybe in the jaw, in the neck or shoulders, in the belly. See if you can release any unnecessary tension that you're holding here. Let go of any gripping, any squeezing, any tightening, any lifting. This is just a quick pass, a quick body scan to see how you're holding yourself. And you can do this throughout your day. We all have tension habits that creep back in. So take another pass. What are you holding on to? What can relax? As we move through each area of the body, there's a willingness to soften and relax. You might not be able to relax right now, and that's okay. With your attention in your feet, just noticing the shape, the volume of your feet, the way your feet are connected to the surface below. A willingness for the feet to be heavy and relaxed. Slide your attention up into your shins, your calves. Feel the weight of the calves hanging on the leg bones. Swirl your attention around your knees. Feel the weight of your thighs on the chair. Notice how your hips are weighted in the seat. Are you leaning to one side or the other? The whole lower body, a little heavier, a little more relaxed. Notice your belly, your waistline. If your pants are binding, you can unbutton a button or just adjust your waistband. Let your belly billow, your stomach relax. And feel the back of your body lean into the chair. Let the chair fully support you. The shoulders are heavy and relaxed. The arms hanging out of the shoulders. Feel the position of your head in space. The head is heavy, 10 to 15 pounds. Shift it around a little bit. Where can you put your head where it feels weightless? Maybe swallow and clear the throat. Keeping the lips closed, you can allow the teeth to part so that your jaw is relaxed. And notice your breathing. Now, as soon as you notice your breathing, it changes, and that's fine. We're not trying to breathe. We're just noticing the breath happening without judgment. So let the breath be uneven. It may be slow and then speed up. It might pause. Let it get a little bit easier. If you're congested, you can breathe through the lips. Otherwise, breathing throughout the rest of our practice through the nose. And feel the temperature of the air as it moves in through the nostrils. As you breathe out, the breath is a little bit warmer. Now just watch your breathing moving in and out of the body. As you observe your breath, take a quick scan again through your body. Has any tension crept back in? Can you sink yourself into the chair? Now notice as you're breathing that the body moves in response to your breath, just a little bit. Where do you feel the movement in your body? And maybe we extend the range of breath a little bit so you can feel your movement a little easier as you breathe in. Feel the breath moving in and feel a point where you feel full. Breathe in a little bit more without forcing anything. Then allowing the breath to exhale, just fall out of the body. And again, you'll watch the breath moving in. Maybe breathing in a little bit more and then exhale. Release the breath. It falls out of the body. Exhaling, exhaling. When you're empty, exhale a little bit longer. Now just playing with this, a few more breaths. Noticing how it feels. Is it comfortable or uncomfortable? And where is the movement happening? Do you feel it in your chest, your belly, the back of your body? Let's see if we can direct the movement of the breathing. And take your attention to the bottom edge of your rib cage, all the way around your body. You can keep your eyes closed. Imagine that there's a soft gold band about 3 inches wide encircling your torso. And when you gently breathe in, the band expands. When you exhale, the band draws back in toward the midline. The band isn't tight, it's comfortable. Breathing in, expanding. Exhale, sinking back in. Notice the side-to-side movement in the bottom edge of your ribs. Breathing in, moving out to the sides, and as you exhale, gathering back in toward the midline. It's not unusual if this area isn't moving, so you're using your imagination if you need to. If you're stressed out, if you're in chronic pain, the breath is typically a little bit higher, the movement's in the upper chest. Continue with your breathing. Imagining the movement if you don't feel it. And now see as you inhale, if you can feel movement in the back of your body. Maybe as you breathe in, you feel that middle back area, the area of the gold band pressing into the chair a little bit. Maybe you can bring your attention to the front of your body, the area of the solar plexus, right at the front edge of the rib cage, right in the middle. As you breathe in, expanding as you exhale, softening back in. And this takes practice. The more often you practice, the easier it gets. Just another moment here, feeling the breath, and let the breath now just get easier. So it might get quieter, slower, softer. You may hardly feel any movement at all. In a regular, normal, healthy breath, it's not a great big breath anyway. Just a comfortable, easy breath. We just want to make sure that we're breathing. Another habit that we have when we're stressed is holding the breath. So just make sure you're not holding your breath. Now we'll let go of the intentional breathing exercise, this soft gold band breathing, and just allowing the breath to happen. We'll start to open the eyes and come back together here. Coming forward on your chair, if you've used a support for your feet, move it aside and scoot to the front edge of your chair. Now I'm on a rug, so I'm not using a yoga mat under my chair, but if you have a hard floor, when we come to standing, it's nice to have a support under the chair to keep the chair from sliding. So you can do that now. When you're ready, then we'll sit in the front edge of the chair with the feet again in a comfortable position. Where do you feel most stable? Feeling the bottoms of the feet connected to the ground. And we bring the attention to the hips, the pelvis, and I have one here. We're going to play around with a little movement in the pelvis, a little tilting of the hips. When we're stressed out, we tend to hold ourselves pretty tight. I see patients with chronic pain conditions. This area is usually, the movement is very restricted. So it's good to get into the hips and create some mobility. The hips in the middle of the body are connected to the leg muscles, all the muscles around and inside the hips, the lung muscles along the whole length of the spine. So the movement of the hips really affects the whole body. Now as we tip the pelvis forward and back, try and smooth out the movement. And again, if you're not moving very much, it's okay. Changes with practice. I'm keeping my torso upright and just seeing if I can move just the hips. A lot of times when people are trying to create mobility, they move their whole body. And we want to be able to differentiate this movement here. It hurts your back, then don't do it. Now as I face forward again, there's a tipping forward of the pelvis and a tipping back of the pelvis. And as you continue to move your hips, allow the rest of the spine to move along with the movement of the hips. And just experiment a little bit. My hips come forward, I might sit up and create space in my body. Let the pelvis tip forward, maybe roll the shoulders back. And we start to get a wider range of movement. The hips tip back and let the spine soften. Slumping, if that's comfortable. If you have some vulnerability in your lower back, you'll do less movement or anywhere in the spine. Now as I come back up to seated, I'm looking for a neutral position of my hips, so neither forward or back. And as I pause in this neutral position, we're going to tip the hips the other way. So I'm lifting one and then the other. A hip tip. Notice as you're lifting each hip, muscles along the side of the body come together. suddenly working into the sides. Can you initiate the movement from the side of your body? Now let's bring it together, hips back and forth, the tip, and then just walk the hips forward and back on the chair. Just a couple times. Make a big circles on each side. Noticing how easy or challenging this is for you. And then come back to center. Let's bring the feet a little bit wider. And again, find a neutral pelvis. Create space in your body, not worrying so much about a perfect posture, but just feeling spacious and long. And then rotating circles. So not really rotating, we're moving in circles like a spoon in a pot, in a bowl, stirring, keeping the spine straight to begin with. The muscles around the hips, into the pelvis, feel the lower back, and if your back feels okay, you can start to flow around a little bit. And let yourself explore, so the arms might start to move. Feel what the shoulders feel like today. Imagine you've got a big globe around your body, and you're going to paint the whole globe just with movements that are comfortable, that feel good. Now as we slow it down a little bit, let yourself move into a stretch, like a morning stretch, and squeeze and hold the squeeze, and then a slow release and relax. As we work with the nervous system, try another one. Reach and squeeze, hold the squeeze, and a slow relax. So we're informing the brain how to release chronic muscular tension with these movements. This is called pandiculation. You can look that up. We'll use that more. Bring the feet a little closer together and just reach one arm up. If this hurts your shoulder, you can just reach the shoulder up instead of the whole arm. And we'll stretch up. And again, that same feeling of reaching and maybe a little bit of a squeeze, just maybe 20%. Squeeze and hold it. We'll do the other one. Reach up, reach, a little squeeze, and relax. Go back to the first side. Reach, stretch up, and then a little bit over to the side. So now we're affecting the whole side of the body. Let the right hip stay grounded. Imagine a rubber band from your hip across your body into your hand. And we're just going to stretch that rubber band and release it, and stretch it and release, and stretch. This is Delilah, and release. Second side, reaching up, and a little side stretch. Feel the hip grounding down, the rubber band along the side. Stretch it and release, and stretch. And stretch and release. We'll place the hands. This is a good reminder before you practice to put pets away and turn your cell phones off. We'll rest the hands on the lap and just start to slide the hands forward and back. And it feels nice, feeling the hands on the legs feel the hands. And notice as the hands are sliding, there's some movement in the body. And again, we've got a neutral pelvis, lots of length in the spine. And we're moving into a spinal rotation. in each direction, nice and slow. Maybe we can time this with the breath so that when you're moving forward, it's breathing in, and as you exhale, turning to the side. So this slows the movement down, and it helps you to really see and understand what's happening in your body, noticing any resistance. Now we'll continue this movement, but let's do it with the arms on the chest. So now we're not using the hands at all in the movement, but you're feeling how the muscles around the torso are moving you. And the next time you turn, we'll pause there. Imagine the left ribs reaching around to the right if you're turned to the right. And we'll let the gaze turn over the right shoulder. Allowing your torso to do the work here, to hold you here. Just float the hands down, left hand on the right knee, right hand behind the back, and return to the right. The gaze is turning to the right. The eyes are stretching to the right. You know that the movement of the eyes affects muscular tension in the base of the skull, back of the neck. So you can look the eyes way down and way up, and down and up, and then release forward, pause, take a breath. Now hold the arms across the chest, turn to the left. Feel the position of your pelvis. You can do a little pelvic tilt here. Find where your back is most comfortable. And as you turn to the left, looking over the shoulder, relax the hands down. Let the eyes stretch further to the left and gaze down and up and down and up. Come back to center, unwinding, pause, and breathe. We're moving into the shoulders. We talked about the breathing. When we're anxious or stressed out or in pain, the breath tends to be in the chest rather than the belly. So we worked on a gold band breathing to get the movement down here. Many of us all the time have a habit of breathing in the chest, and when we do this, we're using the accessory breathing muscles rather than the diaphragm that's located here. And that creates extra muscular tension in the neck and shoulders and in the jaw and the chest. So we're going to work into the shoulders a little bit. Reach the right shoulder up. And pandiculation, squeeze a little bit, 20%, hold it. Slow release. Smooth release. And again, slowly up, and the squeeze helps to move beyond the chronic tension point you might be holding, informing the nervous system, the brain, how to then slowly release the tension as you relax the shoulder down. And move to the other side, and you can do more of these on your own. Shoulder up, squeeze a little bit, slowly lower. And if you have a lot of tension, your shoulder might be kind of jaggy, so you want to smooth it out. One more. And down. Shoulder down. Reach the right shoulder down. Little squeeze. Slow release. The left side, we're going to go a little more quickly. You can take 15-20 minutes with this on your own. Down on the left side. I'm noticing my pelvis is going into my habit, so I'm bringing it back to neutral. Take a breath. How does it feel? Now we'll reach reach the shoulder back. Right shoulder reaches back. The shoulder reaches back, it stops. Let the elbow keep going. The elbow reaches back. Now when that's as far as it goes, feel your shoulder blade squeeze into the spine a little bit. It goes back a little further. A little bit of a squeeze, 20%. And a slow release. Take a breath and do the other side. So the shoulder reaches back. The elbow. The shoulder blade. Little squeeze. And release. Take a breath. We'll do the first side again, reaching the shoulder back. This time we'll take the hand in front of the shoulder and just maybe slide the hand, encourage the shoulder back. And as the shoulder goes back and we're assisting with opening the muscles, with stretching the muscles in the front of the shoulder, the gaze turns to the left. We can relax that arm. And pause here a little bit. Check your pelvis, space in the body. Just relax. Coming back to center, the other side. The right hand in front of the left shoulder. Reach the shoulder back. You can slide the skin. You can even slide and glide a little bit with the hand. And turn the face. And we're breathing with the chest and the upper area of the body. As muscles get tight. This is also an area that gets really tight when we're using our devices and sitting at the computer. And release and come back. Now the last direction, so we went up and down and back with the shoulders, now forward. So the right shoulder goes forward. It's it's not as easy as the others, I don't think. So reach the shoulder forward and then let's help it a little bit. I'm going to put my hand here and push my shoulder into my hand 20% and then let my head turn a little bit in the direction of the shoulder and breathe. There's some things happening, releasing in the neck. And relax and pause. Just take a breath. Notice the difference between the sides. And then the left shoulder comes forward. Sitting up straight. Press the shoulder into the palm. Let the head turn. And there's a lot happening here. Make sure you keep breathing. When we're learning something new, we often hold the breath. And the body responds to the flow of your breath. The muscles will relax if you're breathing. Not so easy if you're holding your breath. Good, and release. Now we might just do a little bicycle movement of the shoulders, nice and slow. And the opposite direction. And really slow it down like you're pushing the shoulders in each direction. Other way. Good. Pause and just feel what you're feeling. Let's bring the feet a little bit wider. And as we sit in this wide stance, we want to scoot the hips back, walk the seat back a little bit so that we're leaning forward from the hips. We don't want to be leaning forward and rounding the spine, creating lots of space, hinging forward at the hips. Hinging forward, and then we'll lean over toward the left leg a little bit. Now let your right shoulder start to turn toward the ground, and this hand can pivot on the knee. And just find a stretch that's comfortable. You'll feel some stretch along the right rib cage. And you might lean forward a little bit. The left elbow stays up, the right shoulder rolls down, and breathe. to center. Just pause, take a breath. And again, hinging forward from the hips, straight forward. And we'll turn the left elbow or the left shoulder toward the ground and angle toward the right knee. Maybe leaning forward. You can move the head around. Notice where you're feeling the stretch in the left rib cage. Can you revisit your gold band breathing and breathe into the area that you're stretching? And good, coming back up. Pause, you can bring the feet a little closer together. Notice how you're feeling. Now let's bring the right knee up. You can hold the knee to the back of the leg. Give it a little squeeze. Show you from the side. I'm just a neutral pelvis. Even here, we can play with the tip of the pelvis. I'm sitting up tall, hugging my knee in, and I'll rotate the ankle. Nice and slow, as if you're pushing through warm mud. So you feel it a little bit more that way. Go in both directions. Then let the foot relax and push the knee away. The arms straighten and we'll let the spine round. The hips are tipping back. Dip the chin into the chest. We can get into that space between the shoulder blades. Now pull the knee back in, sit up tall, roll the shoulders back. The shoulder girdle rolls back, shoulder blades might come together on the back. And let's move with the breath. Exhale, round. Inhale. Exhale. Now see if you can create a little resistance between the hands and the knee. And it kind of turns into a weight machine, a make your own resistance machine. Good, now we'll do the other side. Put that one down. Bring the left knee in. Press it forward. Round the spine. Feel the stretch. Come back up. Let's do this ankle. Slow rotation. Pushing through both directions. Relax any tension you don't need. I just caught some. And then exhale. Inhale. So you might have to slow it down. Exhale. Inhale. Exhale. Good, and we'll put that one down. Now let's just march the feet, march the knees. And we're using the muscles, the hip flexors, the muscles that bring the knee up toward the torso or that help the torso move toward the leg. The hip flexors, the main hip flexor that comes into play when we're stressed out is the psoas muscle or the iliopsoas muscle group. This is a muscles on either side that go from the lower back through the pelvis and attach to the top of the thigh bone. These muscles respond to the nervous system when you're in a stressed mode, and they tend to bring you in. Just think if you're afraid, if you're scared, you clench in. Also, when we're sitting at the computer all day long, we're not really using our hip flexors much. So let's keep going here and add some arms. This gets the brain working. Alternate moves. Good. We're going to be working more with the hip flexors when we're standing. Good. Now take a break. Feel the tilt of your pelvis. Find neutral. Feel your feet on the ground. Take a breath and come up to standing. So we're going to come behind the chair, and I'll turn sideways for you. Take a step forward with the right foot and a step back with the left foot. We'll let this front knee bend any amount. And the distance of your feet, it's up to you, whatever you're comfortable with. You might have a wider stance like this, or you might need to be closer together. The width of your feet is about the width of your hips. And just feel what you're feeling. So we're getting some stretch in different places. Let's have the back heel up and working from just this back ankle. Let's lift and lower. You can hold on to the chair or work on your balance. We can also bend the knee. So we're working from the knee now. And when we're moving the leg, you might notice how you are again working into the pelvis here. So just see what's available in the hips for movement. Nice and slow. And the knee. Pause. Now the front knee, straighten and bend. Good. You might be really feeling it by now, so if you need to take a break, if anything hurts, please do that. Take a break. You don't want anything hurting. Good. Now we'll bend the knee, lean forward, the weight in the front foot, and step forward. Now we'll take a little break here. Shake the muscles out. Let your knees be shaky so that your thighs are all jiggly, calves get jiggly. These jiggles are a great self-assessment tool. If you're not jiggling, you know you're holding tension. Relax that. Do the elbows. So the elbows are moving quickly so we can get all the muscles around the hips and belly moving. Feels really good. And we'll do the arms. Maybe some little bounce. Good. And we'll do the other side. Left foot forward, right foot back. Bending the front knee any amount where you're comfortable. Most people feel more comfort in the knee when they keep the knee above the ankle rather than reaching the knee forward. Even weight across the balls of the foot, and we'll start in this back ankle. Lift and lower the heel. So we're working in stretching some of the muscles in the hips, working with the muscles in the legs, working on balance. And can you breathe while you're doing all of this? Good. Now from the ankle, we'll go to the knee. And as we move this knee, you feel a little bit more movement in the hips. You might challenge the balance a little bit more. Good, and then straight back leg. Straight and bend the front knee. And you know, everything, you can play around with all of it too. Good, and we'll lean forward. Step forward and jiggle the knees, hips. Shake the arms and a little bouncing. Bouncing. Maybe Move around a little bit and let's do a pandiculation stretch. Find a stretch, squeeze. Slow release, a little more shaking. It's a great tension release. And stretch. Okay, so now we're going to stand behind the chair with the feet a little bit wider. And again, make sure that if you're using your chair for support that it doesn't move. You have a mat underneath or a rug like this. We'll turn the right foot out and back that right heel back a little bit. So when you look down, your heels pretty much line up. And bend this right knee any amount. Bring one arm out, the other arm out. We'll turn the palms up, roll the tops of the shoulders back. Palms down, roll the shoulders forward. So we're just feeling the position of the shoulder girdle, the collarbones, the shoulder blades on the back. Good. Take your right hand onto the leg and just lean over so that your torso's in line with your leg. And breathe. Maybe we can swing this arm up, move it around a little bit, and then pull back like you're pulling on a bow, and then push, and pull, and push. Look at your arm. If your neck is okay, look up a little bit. Let's take the hand behind the back, press the hand into the lower back, roll the shoulder back, turn the gaze down. We're keeping the neck in line with the spine, so we're not doing this. Bring the arm up and look at it. Bring it back, roll the shoulder back, the chest opens, look down. Inhale, exhale. Breathe in, breathe out. Good, come back up to center. Bring the feet together. You can do a little knee shake. Shake things out a little bit. Second side. Turn the left foot out, the right foot angles in. Scoot the left heel back a little bit, line up your heels, bend the knee, bring the arms out. Reach out through the fingers, expanding from the heart out through the fingertips, sinking down through the sitting bones. Turn the palms up, roll the tops of the shoulders back. Lift up through the top of the head. Turn the shoulders forward and up. So we're getting mobility in the shoulder blades, a little movement up in the shoulders, strengthening in the arms. If you need to straighten your leg, you can. Good. Pause, angle. Let's let this arm stretch up. You can experiment with stretches. Experiment all through your practice. Whatever your body wants to do, let it. That's how you find things. You discover things. And then pull back. And then push. So there's an element of the pandiculation here, that reach and squeeze and stretch. And I'm getting movement along the whole side of my body. Reach from the fingers down to the heel, that rubber band, pull. Long rubber band. And then bring the arm behind the back, roll the shoulder back, press the hand into the lower back, look down. And up, down. Inhale, exhale. If you're needing more, you can have your hand or your elbow down. I actually work a little harder up. Good, and then straighten and come up. Walk the feet together and back to our jiggles. Knees, arms, hips. Now as we do one final full body jiggle, imagine your skin, your outer layer like a skin suit, and it's just jumping around the inside of your body. So see if you can feel the movement all over. Step from side to side. Now these jiggles, we're letting them go all the way into the organs, so like a bowl of jelly. Can you feel the inside of your body also receiving these tremors of movement? Relax your belly. Now you can move into the neck by dropping the head down, but if you have any cervical spine, neck issues, if you're vulnerable there, keep your head up. Good, and then maybe one more stretch. And release. And we'll come down to seated. Bring your support under the feet if you like, and we'll take just a couple of moments here to integrate all of the work that you've done. So close your eyes. And a body scan. How does your body feel? How does it feel different from when you began? Are there any areas of unnecessary tension? Let the full weight of your body sink into the chair. The shoulders are relaxed and heavy, the jaw, the belly. Noticing the flow of the breath, just moving gently in and out of the nostrils. Nothing to do here but observe. Thank you, body, for all of the work that you've done today. When you get quiet, the mind often becomes distracted. So if you find your mind wandering, bring your attention back. You can observe the breath, the feel of the breath in the nose, the movement of the gold band around the bottom edge of your rib cage. And I'll be quiet. On your own, you can take a little longer. But for now, we'll come back together, starting to open the eyes, stretch out the legs, rotate the ankles. Let's rotate the wrists nice and slow. Let the arms stretch out. Find one more stretch. And bring the palms together in front of the chest. Thank you so much for sharing practice with me today. Have a wonderful day or evening. Namaste.